Welcome to Local Health Now with Guthrie. I'm Sarah Horbakowitz, and I'm here today with Guthrie radiologist Dr. Geneva Ballard to talk about breast cancer as it is Breast Cancer Awareness Month. Thanks so much for joining me.
Thanks, Sarah.
So when should women start considering breast cancer screening?
So we want all women to be aware of their breast health in general, from adolescence on. But really around the age of 30, we like women to start thinking about their risk relative to breast cancer and talking to their provider about, their family history and could they be someone who could benefit from starting screening early. Some patients with strong family histories want to start screening mammography and potentially also screening MRI as young as 30 years old. But patients with a regular risk for breast cancer, no strong family history or other big red flags are going to start screening at 40 and continue screening annually as long as they're in good health.
And you mentioned early screening. Can you tell me a little bit about why and the importance of early detection?
Sure. Early detection for breast cancer really gives us an advantage over finding a breast cancer once it becomes clinically apparent. So once a woman can feel a lump or have other symptoms related to her breast cancer, it is given the cancer time to grow and potentially spread. So the goal of screening, particularly screening mammography as well as screening MRI, is to find those cancers at their very earliest stages. So we're much more able to treat them effectively and with much less aggressive therapy.
Yeah, and so I see that imaging behind you. Can you tell me about why imaging might be so important and if a mammography is the best way to detect breast cancer?
Yeah, so screening mammography is really our mainstay for detecting breast cancers early. The majority of our sites offer 3D screening, so this is slightly different than what we had traditionally done with 2D screening. It actually gives us an opportunity to look through various layers of the breast tissue that might be overlapping on a 2D image to detect small cancers that could be hiding behind an area of denser tissue. So screening mammography is really the way we're detecting the most cancers in the vast majority of women, even with dense breast tissue.
Well, thank you so much for that information. Make sure to tune in next time for more information on breast cancer awareness and breast health. For Local Health Now with Guthrie, I'm Sarah Horbakowitz.